Hello guys, today I will discuss the rest of two important causes of small gut diarrhea. That is Crohn's disease and ileocecal tuberculosis. Crohn's disease, it can affect the gut, literally speaking, from mouth till anus. So it can present with small gut features diarrhea, or it can present with the features of large gut diarrhea. And along with this, patient can have anorexia, weight loss, and he can present with nutritional deficiencies like moan pains, and a patient can also have fatigue and joint pain. Then he can present with eye redness and certain type of ulcers. They can also be present on the lower limb of the body, which is called pyoderma gangrenosum. And these ulcers, they are quite typical of inflammatory bowel disease. As far as the Crohn's disease is concerned, the inflammation is patchy in the intestine, and these are called skip lesions. And then location, as I've already told you, that from mouth till anus, it can involve any part. Then inflammation is throughout all the layers of intestine. It is transmural, and there is a cobblestone appearance as well in the intestinal lumen, and there are strictures as well as fistulas. So fistulas actually is an abnormal communication between the two parts of gut, or it can be between gut and some other viscera like urinary bladder or any viscera in the vicinity. Then after that, we have the investigations. How do we investigate Crohn's disease? If the patient has got diarrhea, the invasive investigation is diagnostic, that is colonoscopy, and we can take the biopsy of the suspected area. And then there is double contrast barium enema. This is the double contrast barium enema of the patient, which is showing a stricture in the gut. Then how will we treat Crohn's disease? Of course, we can give steroids, which improves patient condition in 75% of the cases. And then after that, we can use other anti-inflammatory medications like 5-aminosalicylic acid derivatives. We can use antibiotics if there is any acute infection. And after that, we can use different immunosuppressant drugs like azathioprine or methotrexate. And after that comes the role of biological agents like anti-tumor necrotic factor inhibitors, infliximab, and then surgery. But usually patients with Crohn's disease, they require a surgery at a very early stage because of strictures and because of fistulas. And there is recurrence of the disease. Recurrence rate of the disease is very, very high in the patients. Then after that comes ileocecal tuberculosis. Ileocecal tuberculosis is actually the tuberculosis of the ileocecal area, and patient with ileocecal tuberculosis can present with abdominal pain and with lethargy, fatigability, fever, which is low grade, and anorexia, vomiting, and sometimes diarrhea. As far as the signs are concerned, there can be pallor, and there can be ascites in the abdomen, there can be mass in the ileocecal area, or there can be tenderness in the ileocecal area. Then how do we investigate patient of ileocecal tuberculosis? After symptoms and signs, we can get his or her ultrasound done, and in this ultrasound we expect to see any thickening of the ileocecal area, any mesenteric lymphadenitis. And after that, if we find this, we can go for CT abdomen with IV contrast, and we can take the biopsy of any accessible lymph node which shows us caseating granulomas. And thirdly, we can also do colonoscopy, which can be extended backward as far as the ileocecal area, and we can take the biopsy of any suspected area. And after the biopsy report, we can start patient with antituberculous therapy, and we can also take help of surgery if there is any stricture or any adhesion formation. Thank you.